Speaker. You know, I tell you, look at this day out. I mean, we've been, fighting 2 or 3 weeks now, solid rain. And then when we're here on the steps of the Capitol, the greatest state capital in the country, we're graced with this wonderful weather. And hopefully we'll hold off for a few more moments. Let me just say this. My great-great-grandparents came to this country in the 1800s, mid-1800s, and unfortunately, through the years, they decided to leave, and I found myself growing up as a child in Florida. And fortunately, I made my way back here with my family, and I raised my children here. And never in my wildest dreams would I ever have thought that I would be involved in two of the greatest social movements of my life, and I think the lives of most people here. The first came when we took courageous stands to say to our brothers and sisters who are gay and lesbians that they are allowed to marry those who they love and care for. Yes. At that time, I thought that was the proudest moment of my professional career here in the State House. But I can tell you, today marks a second part of that. And now, to understand, to be here, and to say to you folks that health care is a right that every American, every Vermonter should and shall have, that is important, and that is spectacular. It's easy for us to stand up here and say what a wonderful project this is and that we're going to keep on moving. But I can tell you this, we are not going to be able to do it without your help. The next few years are going to be very difficult. As the Speaker mentioned, there are many people out there that would love to see us fail. We have to look at them and figure out why. Many of them may have insurance companies or whatever. They're afraid that they're going to lose some business. For that, I'm sorry, but I have to look at people who are walking around without health care coverage, who aren't able to get in to see a doctor, who are suffering from cancer and other maladies that they will not be able to get treatment for, just because we have a broken health care system. We can't sit by, folks. We all have to get involved. And we all have to be ready to fight the fight that surely will be coming over the next 2 or 3 years. So I ask you today to make sure you're with us back in next January when we start the second part of this fight. And we will win. We'll win because it's right.